afternoon. I'm Pastor Melvin Rushing of the Progressive Baptist Church and the Mount Pilgrim Baptist Church in Baton Rouge, a member of Together Baton Rouge and Together Louisiana. And we welcome you here today. We welcome you here today to join us in expressing our concern about an issue that we believe is vital to every citizen of the state of Louisiana. It has been our experience that some of the worst decisions get made when practical, pragmatic matters get caught up in partisan political disputes. That's one of the reasons that we formed Together Louisiana. Together Louisiana represents about 120 religious congregations and organizations across the state of Louisiana with a combined membership of about 125,000. Our membership crosses the lines of race, economics, geography, and political perspective. We're black, white, rich, poor, and mostly in between. We're from North Louisiana and South Louisiana. We're Republicans, Democrats, and independents. Citizens who work together to develop a common voice around issues affecting our families. So we're doing our part at the citizen level to cut through the partisan divide. Now, we're not naive. So we know that on many issues, overcoming the partisan approach is not going to be easy. But every now and then, there arises an issue of such paramount importance to our state, an issue that affects the quality of life of so many people, that it becomes an ethical obligation to deal with it on its merits instead of its ideological lines. We believe that the current opportunity for increased federal funding to provide health insurance to our uninsured population is one of those moments. We're calling for a practical, pragmatic solution to this problem. We all know the statistics around health care in Louisiana. Louisiana ranks at or near the bottom in almost every vital health care statistic. We have the second highest rate of uninsured adults in the country, second only behind Texas at 24%. Almost 800,000 of our fellow citizens don't have health insurance, enough people to fill Tiger Stadium over 9 times. Louisiana ranks last in the nation or close to it in cancer mortality, diabetes, low birth rate, infant mortality, preventable hospitalizations. Overall, we rank 49th in health outcomes. What's on the table with Medicaid expansion? In short, billions in federal funds and the prospect of providing health insurance to over 400,000 of our fellow citizens. Yesterday, the Legislative Fiscal Office issued its fiscal note on Medicaid expansion. And you know what it found? It found that if we accept Medicaid expansion and provide health insurance to more than 400,000 of our citizens, it would actually save the state money. That's right. The state would save over $550 million over 5 years and $186 million to $510 million over 10 years. Now, we met with the governor's staff a few weeks ago, and the governor's perspective is clear. He wants flexibility around implementing Medicaid expansion. But another thing is also clear. That kind of flexibility that the governor is seeking, other states are winning. I need to say that again. The kind of flexibility that our governor is seeking, other states are winning. The governor of Arizona put into terms of her state's acceptance a clause that automatically ends the state's participation in the program should the federal government's matching fund fall below 90%. The governor of Florida won support for expanding Medicaid through a privatized delivery model. The governor of Arkansas negotiated using Medicaid expansion dollars to help individuals purchase private health insurance through private health care exchanges. Governors across this country, both Republicans and Democrats, have been able to negotiate models for Medicaid expansion that are flexible and tailor-made for the interests and perspectives of those states. But here's our problem. Our governor is not actively pursuing negotiations to decide the terms for accepting Medicaid expansion funding for Louisiana. Yeah. Now, there are press statements and op-eds, but there are no negotiations taking place. So our message today, and you might have already guessed it, is quite simple. Negotiate, Mr. Governor. We believe that you can win a deal for our state that meets your vision of what's best for our state. But to reach a deal, you have to be willing to negotiate a deal. And so again, we say, negotiate, Mr. Governor.